help patients with sort of, impingement on a nerve root, for instance, in the lumbar spine. And the main conditions that you see here sort of, will be sort of a prolapsed intervertebral disc. There are varying degrees of prolapse itself, ranging from merely just an annular strain, along sort of, with sort of a slight bulge, through to complete sort of dissemination of the actual sort of central nucleus pulposus. All right, so obviously sort of, patients come in with a variety of severity. Main thing being that all of these conditions, whether it's an annular strain that's causing inflammation and impingement onto the nerve root in the intervertebral foramina, or whether it's coming from the actual material of the disc itself causing direct compression. A lot can be done to help these particular patients, and obviously sort of, we will look at sort of, some of the examination techniques to identify the area, and then sort of, using suitable techniques to improve the decompression of the nerve root and increase the range of motion to the area of the spine. So some of the main areas of pain location, particularly in the lumbar spine, are going to come from sort of the facet joints, as we've said, the disc. Ligaments can become involved, muscle tissue. We mustn't also forget the fascia as well. Now, I have put in here about the sacroiliac joint, although we are going to spend a module on the sacroiliac joint, because there's a lot of overlap, particularly between L5-S1 and the sacroiliac joints. Some anatomical texts actually say that there is sort of a connection between the joint capsule of L5-S1 and the capsule of the sacroiliac joint. So there's a lot of referral between the two. So I'm not going to concentrate a lot on the sacroiliac joint today, but sort of, we must be aware of its interconnection. But more on the SI joint on the next. So we must be familiar with sort of, these areas. Obviously, sort of, I'm sure you're looking at your anatomy texts just to